Today marks the start of Asthma Awareness Week. Here are some facts that you may not be aware of, but probably should be. More than 1 million New Zealanders live with asthma or a respiratory disease, with nearly 2 deaths each week linked to asthma. It's also responsible for about 360,000 lost school days each year and costs the economy directly or indirectly about $1.2 billion. A more frustrating statistic: only around 15% of health professionals and about 20% of patients reported to know correct inhaler technique, something that would make an enormous difference. And joining us now is Katie Faaiuaso from Asthma New Zealand, alongside Ambassador and former All Black Julian Savea. Morena korua, thank you very much for being with us. Julian, if I could start with you.
Yes.
You were diagnosed with asthma at the age of 4, wasn't it?
Yeah, very
really young.
That's all I could remember. So.
Yeah, how did it affect your life?
Not too much. And like as a kid, I knew I had asthma, but didn't believe it was going to stop me from doing anything. So just carried on through life, and luckily for me, Mum had asthma as well. So I just sort of copied her or followed her, and she just gave it to me when I needed it.
And Katie, the point about inhaler use there, I'm surprised by how low that is, that people don't know the correct way of using them, and doctors, medical professionals as well. How significant is that?
It's hugely significant and has a direct impact on overall control and impact to the health economy as well overall.
How did it, so obviously had a very successful career, so how did you manage it? How did you manage to get to the level that you did?
I think obviously I didn't have much education as a young boy, but getting through, when I got through high school and started getting into professional stuff, I kind of built a routine and started building my education around it. And I feel like the more I knew, it was better to handle. And I always say this, like, the preventer is so important as well for me. And it's like brushing my teeth. So I take it, 2 puffs in the morning, 2 puffs at night. And I just know I'm set, for the day.
So it sounds there, Katie, like education is kind of everything. Are we doing enough? I was surprised when I read those figures, and we have a very big focus on respiratory disease in our house, with our youngest having some issues there. Yeah. But I didn't know a lot of that. Are people aware of what asthma is doing to people living with it? Yeah,
you're absolutely right. There's so many people aren't aware of the statistics around asthma and what a problem it is in Aotearoa. And that's why services like Asthma New Zealand exist. We exist purely for patients who have asthma as a support system and tool and resource. And I think a lot of people are shocked by just how severe asthma is in the country.
And talk to us about, we were just talking off camera about what that was like as well when you were being drug tested and things, and you had to prove that you had asthma all the time. Was that quite a hard?
It was kind of scary, because I was like thinking when it first came in, and I think Drug Free Sport banned the Ventolin, because I was like, wow, am I going to get banned for 3 years for using my inhaler? So yeah, I guess the process was for me to prove that I had asthma, and that was quite tough, because I had to go without it for about 24 hours to like 48 hours, and then come into the hospital like basically wheezing and yeah, just tell me that I had asthma when I knew I had it my whole life. So
is that still happening?
I think it's gone now.
Right, good.
There's some protocols around on game day, how much you can use and stuff like that. So yeah, that's been a big change.
And what impact does asthma and other respiratory diseases, what do they have on the health system?
Yeah, so asthma and respiratory conditions have a huge impact on the health system, and we think about the sort of symptoms of poorly controlled asthma, and those things include things like overuse of oral steroids, overuse of reliever inhaler, people presenting to hospital, and we know that about 15% of patients with asthma who are presenting to hospital then re-present after about 3 months, so that's a significant issue. And also the impact to quality of life as well, which is probably the most important factor when we think about patients with asthma.
And Julian, you've got a couple of kids that also have asthma. There's nothing worse in the entire world, is there, than seeing your kids struggling to breathe?
Yes, my 2 little ones, have mild asthma compared to myself. And the hard part is just trying to get them to use it.
Yeah,
and so, especially my youngest son, he just won't take it, but the spacer, I recommend it so much. It makes it a lot easier than, I guess, shoving the inhaler straight to the mouth, so.
Totally. Are there other messages, Katie, that you want to share with people in Asthma Awareness Week, things that people should know, that parents should know?
Yeah, just that there's a huge amount of support out there for people with asthma, especially whānau living with asthma and think that certain things are normal, like going to hospital, it's not normal. You know, using your reliever inhaler more than twice a week, that's not normal. But, you know, using your preventer or your anti-inflammatory inhaler, that's normal. And also getting support is normal. And Asthma New Zealand have a whole range of resources and other providers on our website that can point people in the right direction if they're unsure.
I remember using an ventilator inhaler when I was younger, playing sport. I mean, it's pretty shocking that people are not using it correctly. Is it? I mean, you would be sort of having a puff on it, and is it just not going in properly? What is it exactly that people aren't doing correctly?
Yeah, that's exactly right. So even with the very best technique, when you're using what we call a metered dose inhaler, which is your Flexitide, your Ventolin, when they're using that without a spacer, the most amount of medication you can get at a time is 15%. So not very much. And using a spacer with an MDI more than doubles that amount, and you get a huge amount more into your lungs where it's needed. Yeah, so it's really important with spacer use, and just echoing what Julian said, it's just paramount to better control.
Yeah, okay.
Right, well, we will put some of this to the Health Minister tomorrow, hopefully. We've asked them on the programme. So Miriam Brown, thank you so much for your time.
Thank you.
Julian Savea and Katie Faaiuaso, well, thank you so much for coming in.
Thanks for having
All right,
me.
it's